Welcome to the 7 most dangerous medications for seniors video. As we age, our bodies can become more sensitive and vulnerable to the side effects of certain medications. In this video, we'll be counting down 7 medications which could be dangerous for seniors, based on the frequency and severity of reported side effects. For example, NSAIDs, such as ibuprofen and naproxen, which are commonly prescribed for pain relief and inflammation, or even antipsychotics, such as haloperidol and risperidone, which are used to treat mental health conditions. But beware, number 3 is going to shock you, as not many people know it. So get ready for some eye-opening information as we uncover the top 7 most dangerous medications for seniors. Number 7. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs, such as ibuprofen and naproxen, are commonly prescribed to seniors for pain relief and inflammation. However, they can have serious side effects, including an increased risk of bleeding and ulcers in the stomach and intestines. These medications work by inhibiting the production of prostaglandins, which are chemicals involved in inflammation and pain. While prostaglandins are beneficial in small amounts, excessive amounts can cause harmful side effects. Excessive amounts of prostaglandins can cause harmful side effects for seniors because prostaglandins play a role in many physiological processes, and an excess of these chemicals can disrupt these processes. For example, prostaglandins are involved in the regulation of blood flow, blood pressure, and inflammation. Excessive amounts of prostaglandins can cause an increase in blood pressure, which can increase the risk of heart attack and stroke. They can also cause inflammation, which can lead to pain, swelling, and other symptoms. In addition, prostaglandins can also affect the gastrointestinal system. Excessive amounts of prostaglandins can cause an increase in stomach acid production, which can lead to ulcers and other gastrointestinal problems. This is especially true for seniors who may be more sensitive to the effects of prostaglandins due to the thinning of the stomach lining that occurs with age. This is why it's important for seniors to use caution when taking medications that can affect prostaglandin production, such as NSAIDs, and to discuss any potential side effects with their healthcare provider. Number 6. Benzodiazepines. Benzodiazepines, such as Xanax and Valium, are a class of medications that are commonly used to treat anxiety, insomnia, and seizure disorders. They work by enhancing the activity of a neurotransmitter called GABA, gamma-aminobutyric acid, which is involved in the regulation of anxiety and sleep. GABA is an inhibitory neurotransmitter, which means that it helps to reduce the activity of certain nerve cells in the brain and spinal cord. By enhancing the action of GABA, benzodiazepines can help to calm the nervous system and reduce anxiety. However, benzodiazepines can also have side effects, including dizziness, drowsiness, and impaired coordination. These side effects are caused by the sedative effects of the medication, which can affect the central nervous system and cause sedation and drowsiness. In older adults, these side effects can be more pronounced as the metabolism and clearance of benzodiazepines may be slower in older individuals. This can lead to a buildup of the medication in the body, which can increase the risk of side effects. The risk of falls and accidents is increased in older adults who take benzodiazepines due to the dizziness, drowsiness, and impaired coordination that can occur as a result of the medication. These side effects can affect balance and coordination, which can increase the risk of falls and accidents. It's important for older adults who are taking benzodiazepines to be aware of these potential side effects and to use caution when engaging in activities that may be affected by the medication, such as driving or operating heavy machinery. While they may be effective in the short term, they can cause serious side effects when used long term, such as memory loss and confusion. It's important for seniors to use caution when taking benzodiazepines and to discuss any potential side effects with their healthcare provider. Number 5. Opioid painkillers. Opioid painkillers, also known as narcotic painkillers, such as oxycodone and hydrocodone, are commonly prescribed to seniors for chronic pain management. They work by attaching to specific proteins called opioid receptors, which are found in the brain, spinal cord, and other parts of the body. When opioid painkillers bind to these receptors, they can block the transmission of pain signals and can produce a feeling of pain relief. However, opioid painkillers can also have dangerous side effects, such as slowed breathing and decreased heart rate. These side effects are caused by the effects of the medication on the central nervous system, which controls important functions such as breathing and heart rate. Opioid painkillers can slow down the activity of the central nervous system, which can lead to slowed breathing and decreased heart rate. In addition, opioid painkillers can also affect the respiratory system by decreasing the drive to breathe. This can lead to a condition called respiratory depression, which can be life-threatening if not treated promptly. Opioid painkillers can also affect the cardiovascular system by decreasing blood pressure and reducing the amount of oxygen that is delivered to the body's tissues. It's important for individuals taking opioid painkillers to be aware of these potential side effects and to use the medication as directed by the healthcare provider. It's also important to discuss any potential risks and side effects with a healthcare provider before starting a new medication. Number 4. Blood thinners. Blood thinners, also known as anticoagulants, are medications that are used to prevent blood clots from forming in the body. They work by inhibiting the production of certain proteins that are involved in the clotting process. This can help to prevent blood clots from forming, which can reduce the risk of conditions such as stroke, heart attack, and deep vein thrombosis. However, blood thinners can also increase the risk of bleeding and bruising. This is because blood thinners can make it more difficult for the blood to clot, which can lead to increased bleeding and bruising. This can be especially problematic in situations where there is an injury or surgery, as it may be more difficult for the blood to clot and stop the bleeding. It's important for individuals taking blood thinners to be aware of the increased risk of bleeding and bruising and to take precautions to reduce the risk of injury. This may include avoiding activities that could lead to injury, such as contact sports, and avoiding the use of sharp objects, such as scissors or knives. Number 3. Antidepressants. Antidepressants are medications that are used to treat depression and other mental health conditions. They work by altering the levels of certain chemicals in the brain, such as serotonin, norepinephrine, and dopamine, which are involved in mood regulation. Antidepressants can be effective in improving mood and reducing the symptoms of depression, but they can also have side effects, particularly in older adults. One side effect of antidepressants is an increased risk of falls and fractures in older adults. This is because some antidepressants, particularly the older tricyclic antidepressants and monoamine oxidase inhibitors, MAOIs, can cause dizziness and drowsiness, which can affect balance and coordination. This can increase the risk of falls and fractures, especially in older adults who may already be at a higher risk due to age-related changes in balance and coordination. Antidepressants can also interact with other medications and can cause dizziness, drowsiness, and dry mouth. These side effects are caused by the effects of the medication on the central nervous system and the autonomic nervous system. The central nervous system controls functions such as thinking, movement, and sensation, while the autonomic nervous system controls functions such as heart rate, blood pressure, and saliva production. Number 2. Statins. Statins, such as atorvastatin and simvastatin, are medications that are used to lower cholesterol levels and reduce the risk of heart disease and stroke. They work by inhibiting the production of cholesterol in the liver, which can help to lower cholesterol levels in the blood. Statins are generally well tolerated and can be effective in reducing the risk of heart disease and stroke, but they can also have side effects, particularly in some individuals. One potential side effect of statins is muscle pain and weakness. This is because statins can interfere with the production of a protein called coenzyme Q10, CoQ10, which is involved in the production of energy in the body's cells. A deficiency of CoQ10 can lead to muscle pain and weakness, especially in people who are taking high doses of statins or who have been taking the medication for a long period of time. Statins can also cause memory loss and an increased risk of diabetes. The exact mechanism by which statins can cause these side effects is not fully understood, but it is thought that the medication may affect the levels of certain chemicals in the brain that are involved in memory and metabolism. Some studies have suggested that statins may increase the risk of memory loss and diabetes, although more research is needed to confirm these findings. Number 1. Antipsychotics. Antipsychotics, such as haloperidol and risperidone, are medications that are used to treat mental health conditions such as schizophrenia, bipolar disorder, and severe depression. They work by altering the levels of certain chemicals in the brain, such as dopamine and serotonin, which are involved in mood and behavior. Antipsychotics can be effective in reducing the symptoms of mental health conditions, but they can also have serious side effects, particularly in older adults. One potential side effect of antipsychotics is drowsiness and dizziness, which can affect balance and coordination. This can increase the risk of falls and fractures in older adults who may already be at a higher risk due to age-related changes in balance and coordination. Drowsiness and dizziness are caused by the effects of the medication on the central nervous system, which controls functions such as thinking, movement, and sensation. Antipsychotics can also cause other side effects, such as dry mouth, constipation, and blurred vision. These side effects are caused by the effects of the medication on the autonomic nervous system, which controls functions such as heart rate, blood pressure, and saliva production. It's important for older adults taking antipsychotics and any of the mentioned medications to be aware of the potential risks and side effects of the medication. It's also important to follow the recommended dosage and usage instructions for the medication and to report any unusual symptoms to a healthcare provider. Thank you for watching this video. We hope you found this information helpful and learned something new. If so, hit the like button and subscribe to our channel. Stay tuned for our next video, where we'll be discussing a super interesting topic that I'm sure you'll love.